Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Here's your host, Cyrus Webb.
Welcome back, everyone, to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again. For a radio audience tuning in at WYAD 94.1 FM and WYADonline.com, we're glad you all can be with us. Also, tuning in to our friends at iHeartRadio and Amazon Music Podcast. We're glad you all could join us as well. Well, May is recognized for a lot of things, including Cystic Fibrosis Awareness Month. Did you know that the life expectancy for someone with CF has roughly doubled thanks to treatment advances that have been made? Today, the median survival age is estimated to be 65 years old. That's a true testament to years of research, but there's still a lot more work that lies ahead. Here during Cystic Fibrosis Awareness Month, we're excited to be able to talk to Dr. Fredrick Goor to our program today. He's going to talk to us not only about what cystic fibrosis is, but also about the treatment options and where you all can go for more information. Dr. Van Goor, thank you again for the time. Really do appreciate it.
Well, thank you very much for having me.
So this is an important topic we've been talking about here on the radio side here in Mississippi about cystic fibrosis. But why don't you let our audience know, Dr. Van Goor, what exactly is cystic fibrosis?
Cystic fibrosis, or CF for short, is a rare genetic disease that progresses from birth. It leads to multi-organ damage and early death. It's caused by a missing or defective protein called CFTR due to mutations in the CFTR gene. When this protein doesn't work properly, various organs can fill up with this thick, sticky mucus. In the lung, for example, this thick, sticky mucus clogs the airways, making it difficult to breathe, traps germs that can lead to recurrent lung infections and respiratory failure.
So for our audience out there then, Dr. Van Goor, if they're interested in, if it may be something that they're impacted by or maybe a loved one, what are the symptoms they should be on the lookout for?
Yeah, because CF is a genetic disease, the symptoms can start early in life, and they include poor growth, poor weight gain, digestive problems, as well as frequent coughing up a thick, sticky mucus, and frequent lung infections.
And so for our audience then, as I mentioned in the lead-in, Dr. Van Goor, of course, I mean, things definitely have improved thanks to research. So what are the treatment options for someone who has been diagnosed with cystic fibrosis?
Yeah, there's been various different treatment options to treat the symptoms of CF, but Vertex, for the last 20 years, we've been working on medicines that treat the underlying cause of cystic fibrosis. The most recent of these is a medicine called Trikafta, and it can treat up to 90% of people with CF. And just last week, we got approval from the FDA to treat children ages 2 to 5. And this is important because, as I said, the symptoms start early in life, and this will allow about 900 more children in the U.S. To potentially get access to Trikafta. And just yesterday, we got approval for another one of our medicines to treat babies from 1 to 4 months of age.
And I'm sure that early detection and that treatment definitely makes a difference. As I mentioned, this is Cystic Fibrosis Awareness Month. So since it is recognized this month, what makes this month so special, Dr. Van Goor, that our audience should keep in mind?
Well, May is a special month for people with cystic fibrosis because it's a time to reflect on the progress that we've made, but also that there's more to do. So about 10% of people with CF don't respond to one of our medications. And so we've been partnering with Moderna to develop investigational CFTR mRNA therapies to treat the last 10% of people with CF. And with over 180 clinical trials that we've completed or are ongoing, this reflects our commitment to treat all people with cystic fibrosis.
Dr. Van Goor, I didn't mention it in the intro, but you are the Vice President of CF Research at Vertex. Where can our audience go for more information?
Yeah, you can go to our website at vrtx.com to learn more about our CF programs.
and we'll make sure that we link that up for our audience as well. Again, everyone, we've been speaking with Dr. Fredrick Van Goor. He, again, is the Vice President of Cystic Fibrosis Research and Head of Cystic Fibrosis Research Program at Vertex, talking with us not only about what the CF is, but also what you guys should be on the lookout for when it comes to symptoms, but also about the treatment options. Dr. Van Goor, thank you again for the time. Really do appreciate it.
My pleasure. Thank you for having me.
Glad to do it. And we thank your audience for tuning in to another great segment of Conversations Live, part of our Music and News segment here at WYAD. Until next time, I'm your host, Cyrus Webb, saying as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live. Now let's go make today amazing. Take care.